Hi, today we're going to talk about the eye and the ocular adnexa and the auditory system. The subsection here involves procedures on the eyeball, the anterior segment, the posterior segment, the ocular adnexa, and the conjunctiva. These different parts of the eye that I have here in parentheses, I got that out of the CPT code book, looking at the table of contents and seeing which parts of the body were included under the anterior segment, for example. So if you ever don't know what is included in a given section, you can go to the table of contents and follow it there. This is a screenshot taken from the CPT code book showing the eye's anatomy. I write in pencil so that I can erase, and so it's not very dark on a slide. But you can see where I have referred myself to page 418 in the code book to see all of the muscles, because this particular diagram only shows the two horizontal muscles. Each eye has 6 muscles, so we have to always watch our code descriptions and be sure that they are written to unilateral or bilateral so that you use the appropriate modifiers. And when I refer myself to this page, here are all the extraocular muscles of the right eye, and it's telling me each one of the 6 and where they're located on the eye. There's also an unlisted category in this section, and many of the LASIK procedures are categorized in this category for the anterior segment. So rather than having a specific CPT code, you're going to go to that unlisted category. And I have here that LASIK is the acronym. I'm not sure I can say this correctly. I believe it's pronounced laser in situ keratomileusis. Fortunately, we get to just say LASIK. As I mentioned earlier, be sure that you read your descriptions carefully. Most of the eye procedures are unilateral, so if a surgeon is performing the same procedure on both eyes, you will need a modifier. If it's unilateral, you're also going to use a modifier, left and right. And if it's related to the eyelid, remember that there are specific modifiers located on the inside cover of the front page of the CPT code book that tell you which modifier you would use for the eyelids. Another procedure is a cataract extraction. And there's many parts listed at the beginning of this subsection, but you do not code them separately because they are considered part of the extraction procedure. And the 2 types of extractions are extracapsular and intracapsular. Extracapsular includes removal of the lens material without removing the posterior capsule. And intracapsular extraction is removal of the entire lens, including the posterior capsule. Often you will see a procedure where the cataract is extracted and then an intraocular lens prosthesis is inserted. Codes are differentiated by whether or not this intraocular lens prosthesis is inserted during the same operative episode as the cataract extraction or in a subsequent encounter. And this is listed here in these codes. Strabismus is a condition where one of the eyes is kind of either turned inward or outward, and this is surgically corrected on the muscles that regulate the movement of the eyeball. This range of codes requires documentation of the number of muscles involved and the type, horizontal or vertical. As I mentioned earlier, procedure descriptions are usually unilateral, so always watch for your narrative and your operative report to be sure that you're picking up on whether or not it's one eye or more than one eye. Here we have a list of those 6 muscles that are attached to each eye, the 2 horizontal, named lateral rectus and medial rectus, which move the eye from side to side. And there's 4 vertical muscles, inferior rectus, superior rectus, inferior oblique, and superior oblique, which move the eye up and down. And here's our first scenario. Strabismus correction involving the lateral rectus muscle. One thing I did differently for this podcast is I have inserted medical necessity. You always must have medical necessity anytime you have a procedure. I just haven't made it a part of our slides to this point, but I want to start doing that. And I also want you to be Continuing to use your ICD-10 book, because when you get into the field, if you're going to be a coder, you'll be using all of your code books. So you will not be graded on this, obviously, but it just gives you an opportunity to use the skill set that you've developed, finding codes in ICD-10-CM, and find those codes, and I will have the correct answers here for you so you can check yourself. So this particular surgery, this procedure, is involving the lateral rectus muscle. So if you remember from an earlier slide, the code book's going to ask us how many muscles are involved and the type. So when we go to this screenshot of the code book, and here's the codes down here at the bottom, or I have them in my code family. I have it circled. Strabismus surgery involving 1 horizontal muscle, 2 horizontal muscles, 1 vertical muscle, 2 or more vertical muscles. There's also good diagrams in your code book about the strabismus surgery, both horizontal and vertical. And here's your correct answer. You see that the lateral rectus is a horizontal muscle. And here's your ICD-10 code. If we had a true case study or were reading an actual medical record, it would probably have a lot more information than what we're given in our textbook, our CPT textbook. So I only had strabismus unspecified. There's many types of strabismus when you look in your ICD-10-CM code book, but I just chose the unspecified because that's all I know at this point. And this is the code that you would use. Again, I'm just adding the medical necessity so that you become aware you will always need medical necessity anytime you're doing a procedure. Your job in these exercises is just to find the CPT code associated with this body system. Strabismus is your main term you're going to find in the index, with repair in 1 horizontal muscle, the lateral rectus. And as a reminder, if you can't remember, you're going to go back up here, find your muscles, and if you might be a good idea to write in your code book this information. The lateral rectus and medial rectus are your horizontal muscles, and the 4 vertical muscles are the inferior rectus, inferior oblique, and superior oblique. Okay. The next one is an orbitotomy of a right eye to remove a piece of glass. Now I search for this term, orbitotomy, use my Google search engine, where you type in orbitotomy and a colon and hit search, and it will give you a definition. And this tells me it's a surgical incision made into the orbit of the eye to allow the removal of a tumor or a foreign body, treat a lesion, or drain an abscess. And if you remember your medical terminology, the suffix otomy, O-T-O-M-Y, is cutting into. Medical necessity, your diagnosis is a penetrating wound of the orbit with a foreign body, right eye. And here is our correct code group. You see that the first group of codes is an orbitotomy without a bone flap, and the second group below it is with a bone flap. There's no mention of a bone flap, so we will not be coding that. And here's our answers. Be sure you add your modifier for the right eye. And here's the ICD-10-CM code to demonstrate our medical necessity. You have to be careful too when you're coding this ICD-10, because I assumed it was a penetrating wound because they had to go into the eye to remove a piece of glass. Again, if you were reading an entire medical chart, you would have a lot more information than just this phrase. There are external, you can have foreign bodies in the external eye as well. So those would be different codes. And here's an excisional transverse blepharotomy with 1/3 lid margin rotation graft. Anytime you see the words excision and then a graft, you are repairing something. In this case, the blepharotomy tells us that's an eyelid. You're cutting into an eyelid. And I give you a little information here if you've never heard of this type of procedure. You can go in, like I copied the entire phrase there for the procedure and searched and read a couple of websites just to get an idea of when a student or coder might see this particular procedure. And I have the information here in my note. usually caused by burns or something, physical accident, or a severe chronic inflammatory disease such as trachoma. Then I looked up trachoma. I wasn't familiar with that word, and it is a contagious bacterial infection of the eye that affects the inner surface of the eye, the eyelid. So then when I go to the ICD-10 book, what do you know? There is a diagnosis of trachoma. I chose active stage because the fact that a graft is being done, I'm assuming this is something that's been ongoing and is now being treated this way. Again, if you were reading a medical chart in its entirety, there would not be an assumption. You would have the facts there for you, and if not, you would have to query the doctor. But more than likely, these things would be in there. And here's your ICD-10 code for trachoma and your CPT code for your eyelid repair. You notice in the index, the first entry is excisional, and then there's an indentation where it says over 1/4 of lid margin. And in our procedure description here, it says 1/3. 1/3 is more than 1/4. Therefore, you would use the 67966 code. The next procedure, a patient has trichiasis, and cryosurgery is being used to destroy those follicles. These are eyelashes that are chronically growing in, so that the patient's having to have a procedure. So the doctor's going to go in and just use cryo and just destroy those particular specific hair follicles that are continuing to grow in. And the diagnosis is of the right lower lid. And here you see, this is showing you an ingrown hair or eyelash, and where the physician's going in and just removing that one follicle, destroying it, so the hair no longer continues to grow and irritate the eye. Also, in this particular case, you would be using a modifier to indicate the eyelid, which side it was on. In this case, it's the lower right. And here's your CPT code. Here's your index pathway. And here is your ICD-10 code demonstrating medical necessity. Reminder, you do not have to look these up. I'm trying to give you an opportunity to continue to use your skill set of finding ICD-10 codes, because oftentimes you forget. If you don't use those skills, you forget them. So I'm going to try to just make it available to you without, it in no way impacts your grade, but I just want you to have the opportunity to look up some ICD-10 codes. And if you're wondering why are we not using PCS, well, let's think about this. CPT is outpatient procedures. And outpatient procedures use ICD-10 CM to demonstrate medical necessity, the same as inpatient procedures. But inpatient procedures do not use CPT. Inpatient procedures use ICD-10 PCS, different code set. So here's our next exercise where the patient has severe diabetes with retinopathy and macular edema. The surgeon is using laser photocoagulation to resolve the leaking microaneurysms. There's some leaking blood in the retina. So your diagnosis would be, and your medical necessity, diabetes with retinopathy and macular edema. So we look up that procedure for the photocoagulation, and here it is. It has a specific term, 67210. So here is the CPT code, photocoagulation of a lesion of the retina, and here's your ICD-10 code for the diabetes with retinopathy and macular edema. In case you're wondering, leaking microaneurysms, that is integral to this condition of having retinopathy and macular edema. You have the edema because these things are leaking. So the idea is to coagulate or destroy those lesions that are leaking on the retina. Now let's look at the ear. There are procedures in the CPT code book for the inner, outer, and the middle ear, and you'll see them divided by subsection. But remember that services such as audiometry and vestibular testing, which are diagnostic to whether or not someone has any hearing problems or ear-related problems, those diagnostic services are in the medicine section, which we'll be doing in a few weeks, and not in the auditory system. So if you need to make yourself a note about that, you can, because it is something we haven't covered yet, so it may be a little confusing. One of the most common procedures in this section, the auditory section, is a tympanostomy, which is the little ventilating tubes you put in the small children with chronic ear infections. And a physician may dictate the term laryngotomy when he's putting in these ventilating tubes, but the coder is going to code that procedure as a tympanostomy. I think I mentioned to you in an earlier podcast that a physician may not use the word you need to code. So you have to look at what he or she is doing and code what they're doing based upon what you understand from the terminology in the CPT code book. This is just one example. In our first exercise, under general anesthesia, a surgeon is removing a pebble from the external auditory canal of a 1-year-old. So our medical necessity is the foreign body in the left ear. And here you see in our CPT code book, the codes are differentiated by without general and with general. It sounds a little excessive to me to have general anesthesia, but if you think about a 1-year-old, trying to hold a 1-year-old still while you're messing with his or her ear, and it probably wouldn't feel too good. And there you might accidentally, if the baby jumped or did something, you might accidentally damage the eardrum with the tools that you're using to remove the foreign body. So it would be much safer to put a baby to sleep and not risk any damage to the ear. And here is the T code for the foreign body in the left ear. And here's your CPT code. This is just demonstrating medical necessity, not part of this course. Just a reminder to you, you always need to demonstrate medical necessity before you have a procedure. Whether it's inpatient or outpatient, you have to demonstrate medical necessity. And your CPT code is here with the modifier LT for the left ear. And here's the last one. The surgeon inserts cochlear implants in both ears. Our medical necessities, an unspecified hearing loss bilateral. Here you have the cochlear implant. There's just one code, 69930, for cochlear implants, because the with or without or mastodectomy, there's no mention of a mastodectomy in our procedure, but doesn't matter, it's the same code. Here's the code H91.93 for the hearing loss, and don't forget your modifier -50 because the surgeon is implanting in both ears. Okay, if you have any questions about the eye or the ear, post them in discussion board along with the path you have used to try and find the code, and I will answer them there so we can all learn together. Thank you so much and have a good day.